Hello, and thank you for listening to my Community Health Assessment of Standing Rock Reservation. My name is Julie Wanzik, and I am an MPH candidate for the class of 2018. Standing Rock Reservation is on the North Dakota southern side and the north central South Dakota side, overlapping two state lines. I use the logic model precede, and proceed. And this lends a logical way to assess the community and identify community priority health needs. And I found that there's no one single problem or single variable to take into account, but using the proceed model, we can identify multiple factors and variables that help us elucidate and carry out clarifying the health issues in the community. For precede, I will go through a social, epidemiological, educational and ecological, and administrative and policy assessment. And for proceed, I will look at the implementation of the policies and the efforts, the process of how they did it, the impact that they're making, and the outcomes. Here's an overview in a map form, if that's easier to understand, to help clarify the precede proceed steps. So my windshield survey, these observations were carried out in McLaughlin, South Dakota. First, I have a cousin that lives there, and in visiting her, I found a lot of dilapidated old homes that were boarded up, and they just didn't have life to them or care. The roads, traffic was light, and the roads were not always well cared for. It was quite a bumpy ride, and as you can see, it looks a little depressed, and the cars were pretty much dated and old, but there were some new cars, and yes, that is a porta potty in the middle of nowhere. But there was beauty. There were wide open spaces in South Dakota and North Dakota on the reservation, and I did find some to share with you here. This is the social assessment that I saw within the community. Now, what I did want to highlight is the definition of a tribal member. Please disregard these statistics. It didn't populate as I wanted. But let's look at the definition of a tribal member. It is any person having origins in any of the original peoples of North and South America, and who maintains tribal affiliation. This is through the American Indian and Alaska Native Population Census Bureau gave us this definition. And what I wanted to show you here, let's just go ahead and bring this other area in, is that Standing Rock covers 2.3 million acres, over 1,300 miles of land. And further, the population within that is only 8,217 people. That consists of about 6,400 natives, and the non-natives are about 1,803. So more natives than non-natives over this very large area. However, let's look at the native population, socio-demographics, and economics. The household income in 2000, and this is the most recent data before the Sioux tribe of Standing Rock got lumped with the Cheyenne River Valley Nation. It's very hard for statistical purposes to find more, but this is the most up-to-date. It hasn't varied. $21,000 on average is what the family gets. The education level, most don't graduate high school and even less go to college. They have a 34% high school GED rate and a 23% college attendance rate. The unemployment rate is astronomically high at 86%. They have a low household income, which is below the national level of poverty, as you can see. And the high unemployment rate does induce this poverty level in the families. So those are the socio-demographics, epidemiologic, ecological, and education assessment of the proceed model. So next, I'm going to look at the socioeconomical impacts on health. How does this affect the health of Standing Rock Reservation tribe? First, they have a high infant and child health rate. Maternal mortality and health is depressed than the national United States average. The clinical and preventative oral health is less than the national US average, and I wanted to take a look at that. Sexually transmitted disease and infections are increased in the Native American population. Injury and violence are also up. as well as substance abuse and tobacco use is high in this population, which induces injury and high accident rates. The primary issue that I did find, though, through my research and community assessment was access to health services were depressed, and this is the policy assessment of the PROCEED model. Here is the only health services building through the Indian Health Services in McLaughlin, South Dakota for the reservation, and the next center is 5 hours away in North Dakota. A little bit about this Indian Health Services. American Indian tribes have independent governorship from the United States federal government that are exclusively within the tribal lands. This is the case of Standing Rock Reservation. However, partnerships between the tribal government and the U.S. federal government in 2006 started to relinquish control back to the tribes, but it still supports the social affairs and health affairs. The U.S. aid still flows through these partnerships to such things as the Indian Health Services, transportation, and federal entities. But as you can see, it's pretty minuscule, right? So here, I want to remind you just the massive area. So you can see McLaughlin is about right here, and the closest IHS, that's Indian Health Service building, is here in Fort Yates. McIntosh is another hour, so Fort Yates is about 4.5 hours. McIntosh is even further from McLaughlin. And there's an 8,600 population in this area, and overwhelmingly 6,000 of them are the Native Americans. So health access for Standing Rock Sioux tribe members is an issue, not just because of few health clinics, but the size of the reservation. And I want to talk about cultural perceptions of health services as well in this implementation of services. So let's evaluate the priority health issue, that primary issue of access to health services in the Standing Rock Sioux Nation tribe. There is only one hospital on the reservation with 12 bed services and full-time special care clinicians. Funding by federal government for IHS, that's Indian Health Services, is only 30%, and the rest of the tribe must make up to cover the uninsured. Tribal distrust of IHS services is there, and it is pretty prevalent through my research from interviews as well as from documentation. So how does this impact the community? Well, I'd like to let you know that the impact of disease shows higher rates over state and federal averages in the following areas: chronic diseases like cardiovascular deaths and type 2 diabetes, maternal and fetal mortality, alcoholism and accident-related injuries and death, and STI, that's sexually transmitted infection prevalence, is exponentially high over the national U.S. average. Access to clinical and preventative oral health is also lacking. So the outcome steps to improve this are as follows. So here are the issues first. We've got the distance, right? You saw that massive area. We've got the trust issue because of the inherited Native American history of their people being essentially erased from history and then isolated to these lands. We've got the Medicaid issue of, yes, most Native Americans do qualify for U.S. Medicaid, and they are electing members of our population. Although they are on a sovereign nation, they can still get benefits from the federal government, and they should because of the lack of income. However, not a lot of Native Americans know how to do this Medicaid paperwork because most of them don't even reach out of high school and get their GED. IHS dental staff is 1/3 of that of the U.S. public, so there is about one dentist to every 3,800 patients there in the population. And remember, we only have about 6,000, so you maybe have 2 dentists on that entire reservation. And in the U.S. population, you've got about 1 in 1,600, one dentist to every 1,600 U.S. citizens. So that's a dramatic difference with services to dental care. Next, there's little emphasis on oral care in families, just to curtail onto that. Because the cultural acceptance of dental caries and oral disease is just there. According to my sources from a nurse to a teacher on the reservation. This is just something that families expect. They expect their teeth to be bad, unfortunately. So resources to improve. The Indian Health Services increases communication and open forums of the tribal community as of 2015 through the Winship Center at Johns Hopkins. They are training these 2 nurses that are on the ground there as public health nurses to go out and open forums of trust that bring the patients into the IHS clinics and have roundtable groups with them, counseling the local tribes and options available to them to subsidize their medical care as well as the free clinics. The 2 public health nurses working on the reservation, and there are only 2 of them, they're on the ground. They cover that entire area. They survey, they conduct education, and they increase access. One example I want to give you of a positive story I got out of Jamie Garok. She's a public health nurse of over 25 years on Standing Rock. She told me about a story of a syphilis outbreak and how well Standing Rock Reservation worked with the Indian Health Services to really bring that outbreak down, and they really helped their community. So we've got some good going on here, but really we've got a lot more to do. I wanted to just share with you some personal things that I saw while I was out there in South Dakota doing all of this. This is just an example of the pride of the Indian tribes of America. This is the Crazy Horse Memorial, and it's going to take probably another 50 to 80 years to finish, and they've been already working on it for over 80 years. It should not be finished in our lifetime, but this is what it should look like when it's done. And this can be a great example of funding and lack of resources across the board. Healthcare access is not the only issue. And there I am. I'm that little one right there. I ran a marathon recently there. So I hope you guys enjoyed this. I hope it enlightened you on the community health access to care, healthcare services, disparities there, and what is happening to circumvent it. If you have any other questions, here are my references. Thank you so much, and good luck.